And Ava, this IV nutrition therapy isn't just for dehydration, it's addressing nutrient deficiency too, right?
Absolutely, and as you can tell, hair, skin, and nails, they're already glowing, and Kara did a great job here in the IV therapy room. And Dr. Duffy, inside this room, people can really sit back, relax. It's a 40-ish minute, resting time. So what is all happening here in my IV?
Yep. So we put the IV in, like I said, it's a catheter, so it's like plastic. You can't even feel it, right?
No,
I mean, it's just a quick and easy insertion there, and then your fluid's going in. So what we showed you earlier, those IV multivitamins are going in, so they're actually in the bag now, dripping right into your bloodstream. You've got multivitamins, a B complex, so you're getting all the good Bs in there. You're getting some minerals like magnesium, sodium, chloride, calcium, all that stuff to really help with your muscles. And then we're going to throw in glutathione at the end, and that's the one that's like that antioxidant, that glow, that longevity, anti-aging.
And you put it in the end for a specific reason.
Yeah, so it just works better when it's by itself. When you mix it in with all the other stuff, it sort of gets lost and diluted. So we get better effects if we do it what we call an IV push at the end. So once this bag is all done, then we're going to put it into a syringe and it's going to go right in here.
Gotcha.
So again, you're not getting needles. You know, a lot of people will get injections, for various things, and that's certainly another way to do things, but this is going right into that bloodstream. So
yeah. Well, it's interesting, Margaret mentioned, if you're doing sports, it's great to rehydrate, but people come in, once, twice a week as just kind of a general scheduled event.
Yeah,
talking about that, keeping
prevention, like you were talking about, is one of the best medicines. So if we know that we're being exposed to toxins in our environment, or you have had chemotherapy or something like that in your past, or you have a history of a health condition, a lot of people have autoimmune disease. So they're dealing with arthritis, or they're dealing with some gut type thing. And so having something on a regular basis, so it can be as needed, but if you do weekly infusions, or we have people doing high dose vitamin C for synergistically with their cancer treatments, they might come in 3 times a week sometimes.
Wow. A true wake-up call for your cells, it sounds like, really across the board. So if I came and then I stopped coming, would I notice a huge difference, or does it kind of cycle itself out?
Yeah, it'll cycle itself out. I mean, it's, some people can tell a difference right away. Like, be interesting to see later today, how you feel in terms of energy, and of course how she looks. Of course, she's gorgeous anyway. But yeah, I mean, some of the stuff that's preventative, it's over time. So some people can notice if they're having a big flare-up of one of their, inflammatory responses, like they'll come in and get an IV, and it gives them some pain relief right away.
It'd be interesting to talk to an athlete, maybe who runs a race and does the same race with doing the IV therapy. Have you talked to anybody who
Well, we get CrossFitters, so, we have a CrossFit gym right across, and of course the junkyard's right here too. So people, if they're going to do a competition or something like that, they'll actually come in about a week before and get kind of infused, so it helps their just make sure that their muscles are ready to go, that they have everything they need, and then they'll do kind of a post-recovery for the hydration part.
Well, you really are exerting so much of yourself with working out, but you mentioned travel. I know if you're going for a big meeting, you want to have that glow right off the plane.
Exactly, yeah. Or that prevention, you're going to be on a plane, you're in an enclosed environment with all these people breathing on you, and the last thing you want is to go, to a big meeting or a conference or something where you're speaking, you got that scratchy throat, or you don't feel well. So that preventative, let me just make sure I'm at my best.
Very true. And right along with being your best, anti-aging, a very hot topic with what seems people younger and younger. So we're going to talk about some of the methods that are more holistic when we come back in their laser room.
Okay, Ava, thank you very much. We'll see you again soon.